This is Dr. Dale Bagley, podiatrist, Redding, California. Been at it about 43 years, a lot of different types of fungal treatments. I think in the past, mainly I just removed them. The oral medication works fairly well. They're expensive, and there's some liver things, liver type problems that you have to deal with, so not everybody can use it. And found that there's some topicals along with good debridement of the nails. And we found this product here, Dr. Swaim's. I think it's a good idea. It makes it simple, having just the almost like a chap lip that you put on. We debride them. Another good idea is having the soap, because a lot of times you've got the fungus between the toes, and so you may get it done, but now you got the problem between the toes and it reinfects the nails again. So we find that for the most part, with nail care that we can do, along with this product, we can clear up nails without the expense of those products or this new, not even with this nail cure I hear on television, the laser one, you know, at a tune of about $1,000. I think we can probably do the same thing, and we've seen success, and I've personally used it with success. Probably the only additional is that it's easy application. Many of the stuff that you have out there, it's a liquid you put on, and then it's absorbed with your socks. Where this is like a chap lip, and you just put it on the end of the nail, and you just massage it in, so it's not going to fall off. And so I like that idea, and we're getting good feedback on patients with the success with it. Yeah, I think another thing a lot of times goes with it is hyperhidrosis, sweaty feet, and having this as something you can put in your shoes or right on the feet. And I know myself, I like the idea because it keeps the not only odor down, but it also is antibacterial and antifungal. That you can take one of the problems of sweaty feet, that it contributes to the nice incubation that we see when you stick it into a shoe. And of course, these shoes are probably just loaded with it, so that's why they get reinfected. They may be people that are from damaged nails, but there's a lot of inherited genetic weakness that they develop the fungus nails in skin. So, so what the bottom line is saying here is that you're controlling it, because the tendency for coming back is there. So you got to let them know that. But what I do now is I just use a maintenance between this and this, just to keep it down from coming back. Post-op pain, and one of the things in the 40-something years of practice that we really haven't been able to help people too much with neuritic pain, be it diabetic neuropathy or other forms of neuropathy, that it's the burning feet or it's post-op pain. I found that this has worked as well as, or better than, some of the medications that we have compounded that are very expensive, and these have worked as well or better. And so they're approachable from a standpoint of cost, and they seem to work. We've had even comments that says not only is it working, but my husband's using it on his knee and it's working there, or on my back. So we tell them not only put it on the place there, but places where the nerves are superficial, like around the ankles, the front of the ankles, on the inside of the ankle, to intercept that nerve and have some control of the pain that they're having, burning, numbness. This could be post-op pain. It could be neuritic pain due to their different conditions that we see. Maybe about 50% are diabetics and 50% are not. And even oral medications, Neurontin, Lyrica, Cymbalta are used, but it's just sort of masking it, and sometimes this is just as effective without having to go to the oral drugs. The other product here is the Medicaid foot cream. I like the idea of this after we get the athlete's foot cleared, or I think you could even use this, to sort of control a lot of these diabetics and non-diabetics, they need something to put on that skin to keep this stuff down from reoccurring troubles between the toes, like we just had one just a few minutes ago. Infection between the toes from breakdown of corns and calluses between the toes. So one of the things we're going to use is on the skin but this powder, I think, will be, it's antibacterial and a fungal as well as a drying agent. That's just what he needs.